Welcome, everyone, to Beauty and the Surgeon podcast. I'm Amy. I'm a nutritional therapy counselor, and I am joined, as always, today with Dr. Jason Martin, board-certified plastic and reconstructive surgeon. It is 2019.
So this is the Beauty and Surgeon podcast, and we're starting the new year on a topic that is important to Amy and I, but important to the tenets of this podcast.
So yeah, we have a recurring theme, and it's on our website. It's everywhere. We talk about inspiration, transformation, and education, and those are things that we come back to almost in every single podcast. We kind of bring our topic back to that. So whether we're talking about surgery, transformation through lifestyle, making your nutrition better, being empowered, having the knowledge to talk about things with your surgeon, perhaps. Like, we're always bringing it back to that. But this, for the first podcast of the year, it's called just transformation. Because that's really what we do,
right,
in all ways. So we're always transforming everything around us, the seasons, the days, we're the moon, every single thing around us is transforming at every single second of every day, including ourselves, our bodies. Like, what's that saying? Like, you'll never be this young, or you're never as old as you are right now, but you'll never be this young again.
You always have sayings like this.
I'm like an old.
Do you have a book?
I'm an old wife.
Okay. And it's every single time it always starts with what is that saying?
What is that saying? Who said that? A wise
penny
man once
wise
said.
and dollar assured, or. No,
but that's,
whatever.
It's true, and I think you can either be an active part of the transformation of your life on a daily basis, or you can not. And that's a powerful choice you have to make.
Right. And I think so this podcast is really about transformation. It's to understand, the world around us, but to kind of get our minds in the right place for this next year. So this year, 2019, hopefully is a time that people listening to this podcast will take time out of their lives to realize whatever transformation they've wanted. That could be health, that could be plastic surgery, it could be their mind, whatever. That's the idea behind this. We, in our practice, in our business, offer transformations every day, and that's what keeps us going. People look at plastic surgery and with very weighted eyes, but in its essence, it's about helping people realize something that they've wanted about their bodies. Mm-hmm. And if you listen to our podcast, and we always go back to the episode on self-perception, you'll realize that self-perception is what drives us, what drives our view of ourselves and the world and all that kind of stuff. So these kind of transformations, at least what we do on a daily basis, can be manifested not just with plastic surgery, right?
Yep. They're the main one that we utilize, or the main tool. And I had Sarah do a slide for us that just is the dictionary description of transformation: a thorough or dramatic change in form or appearance. And that's what we do, right? It's not always dramatic, but it's on the outside, but it's always dramatic to the person who's undergoing that transformation, even if it's somebody who was, let's say, assaulted and you fix them on trauma call. That's dramatic, and it's powerful, and it's a change in form or appearance. So I think that the more powerful transformation always happens in the mind than it does on the outside. Like, we can do the most amazing surgery on someone, and if their mind is still just not right, they're never going to perceive it or understand it or appreciate it.
Right.
And that's, I think, the part where all of us, I definitely think about this often is, how can I every day work on transforming, my mind or my thoughts or my approach that makes me a whole and better person, like, every day.
So this episode is basically about how can we get our minds in the right place to welcome in those transformations in our lives. And I think the first and foremost thing is to understand that we're not perfect. And that if you go back through our different episodes in our podcast, listen to Ryan Doris. That was a great episode. He talks about that. You listen to Steve Shaw. He talks about that too, is that to realize that nothing's going to be perfect, right? So you have to start from somewhere and recognize that you don't live in a perfect world. Your life's not perfect, et cetera, et cetera. We have that same conversation for people when they come into our clinic. We talk to them and they're, perseverating. They're so frustrated with their bodies. And I'm like, let's take a step back. You're a good person. You got a good life right now. You have one area that you don't like. Let's compartmentalize that, figure out how we're going to fix this, and move forward, and then be more happy, be enthused and motivated. And that's the first thing, is to kind of recognize that it's okay, right, to have problems. It's okay to be down or frustrated or whatever you're feeling, but to put that in its place and then start making a plan to move forward. And that's the part where I think people get paralyzed, is the plan to move forward part.
Yep. They do. They get stuck.
And you see
Yeah.
that in plastic surgery all the time. How many times do people come in our office and they're like, oh, I've hated this for like 5 years.
Oh, or for 50 years. You know, that we have patients who have always, you know, put a lot of stress on themselves about some physical part of them, you know, and may not even have anything to do with them.
Yeah.
You know, you can't choose the nose you were born with. Yeah, you may have had a twin pregnancy that caused you to have tons of loose skin. Well, you don't regret any second of your twins, but like now you're left with this giant hanging skin on your abdomen. Like, you know, I think I agree with you that it's important, especially when you're considering plastic surgery, to be able to put whatever that is in its place and address it appropriately and with a great surgeon, you know, but don't let it embody everything about you.
That's what I'm trying to say.
Yeah.
So you got to compartmentalize it a little bit.
Mm-hmm.
Ryan Doris talks about that, about Maslow's triangle and about how to compartmentalize your life and make sure all the boxes are checked.
Mm-hmm.
And that's what I'm talking about here. If that's a physical transformation that you want to have, if you want to lose weight, if it's a nutritional transformation, right? So like if you think about the way people look at nutrition, right? They sometimes look at it as all or nothing. But I'm sure when you evaluate people from a nutritional standpoint, they have some good parts of their diet. Most people do, right?
Oh, I mean, I've never met with a patient who didn't
Right.
have some redeeming parts of their diet.
So they have somewhere to start.
Yeah, everyone
right?
does. Yep.
So they can start, you can focus on the positive
Yep.
parts and then start compartmentalizing and changing things you need to do.
Mm-hmm.
That's where I think people get lost. They get overwhelmed.
Yeah.
You know, I think that for any kind of transformation, the part of recognizing that you want to change is easy. The part of getting ready and doing the change is very difficult.
Right. And sometimes that is genuinely hard. Like it sometimes is a long road. You know, surgery, we've said this many times on our podcast, surgery is not the easy way out. Like you're not cutting any corners, you're not cheating anything by doing surgery. Like
Right.
you are not taking the easy road. And a lot of times like surgery can be scary, right? There's pain involved, there's recovery. There's other people's perception of you before and or after surgery that, you know, may weigh heavily on your decisions. You know, we've seen that a lot, that, you know, patients don't always have a super supportive family or supportive friends, you know, so there's making that jump for yourself as well, you know, to kind of rise above all that. You're okay with understanding there might be some discomfort. You've got the downtime. You got somebody to take care of your kids. You don't care that your sister is angry that you're getting a tummy tuck and she's not. Like, all those things you're able to put aside and just like move forward on this path.
Right. Well, I mean, not just surgery, like for weight loss, you know, you have to change your diet around. You may live in a household that people aren't really cool with the decisions you're making,
Mm-hmm.
right? The fact that you have to weigh out your food or measure macros or do whatever you need to do. Mm-hmm. A lot of people will push back against that, and they love you and they want you to change, you know, but they're not always supportive.
Right. And a lot of times that comes from understanding. You know, there are definitely a lot of patients whose family members or spouses are worried about them having surgery, legitimately so, because, you know, it's elective and you're having surgery. Like, what if something goes wrong?
Mm-hmm.
You know, and that's, yeah, absolutely. That's a logical thing to think about.
Right.
You know, and just like, you know, if someone is having issues with like a spouse or their children when they're trying to adjust their diet, you know, yeah, like I said, those people aren't coming generally from a place of, you know, wanting to harm you or keep you in a situation you're not happy in.
Rarely is it malicious. Yeah.
It's usually just education. They don't understand it. And there may be times, you know, when that lack of understanding, you know, really can sway you one way or the other.
Right. I mean, it's easy. With stasis is easy, right? Like not changing is easy. That's a lot easier.
Oh, but
Sometimes I have hard days. I like to go home, sit on the couch, and watch Netflix. I mean, that's the easiest answer. Is that bettering my life? I don't know. It makes me relax. Yeah. But to do a transformation when you're tired and you don't have maybe as much family support as you want, and you know the job is hard, and you know life is kind of beating you down a little bit. It's hard. You have to find that inner strength, and that's what people really struggle with.
Yeah. I mean, you think about it though. Like, does a tree know it's transforming?
Right.
You know, when it's spring, when it's fall, like, does a tree know what's happening? It doesn't. It's just going with the flow and with the season. So if you are at that point, I think in any part of your life, even if you're not trying to make a drastic transformation, understanding that you always are, you know, just kind of letting that happen and like going with the process a little bit more, I think that's beneficial for me to sometimes take a step back and think that way. You know, like this is maybe just a season, you know, this is challenging, even with recovery from surgery, you know, the first couple of days when you're in a lot of discomfort and pain, like that's just part of it. You know, this is just the winter, maybe. Like this is the hard part. Like you're going to get to spring. It's going to start feeling good. You're going to start running up and down the stairs again.
Right.
You know, it's like just having that kind of that underlying feeling that like this is just part of it. Like this is all part of life.
Right. And so compartmentalizing and then going through the process, you just kind of have to keep on moving, right? And the surgery analogy for us is that we literally have people move after surgery. Like that's like the number one thing they're supposed to do.
Yes, get up.
Right. And that's same as true in anything in life when you're trying to do a transformation because, you know, you don't want to stop. Like if you're going to do this change, you want to keep on pushing forward. And because the minute you stop is when the problems happen. In surgery, that's when you get infections, you get blood clots. And any other kind of transformations, you lose your power. Like we talked to Dr. Metz in 2017. He talked about dieting. I keep going back to dieting, but there's a really good comparison with surgery and dieting. You can kind of look at that because dieting is really difficult and so is surgery for people, but the outcome is amazing. And he talked about dieting and the ability of these diets to work is dismal. For people with a certain BMI in a morbidly obese category, only like 1% will be successful after 3 years, right? And so think about those odds and you're up against it and that you have to not allow yourself to stop and kind of revert back into those old, as Steve Shaw would say, his lifestyle.
Right, his lifestyle. And that, I think part of that is just understanding that that change is perpetual.
Yeah.
You know, this is all kinds of like meta, but that you can't stop it. So even if you are sitting at home on your couch watching Netflix and you may think that you're in a slug,
which by the way, I highly recommend.
Right. There's some great shows on Netflix.
Yeah.
Even if you feel like you're in your slug state, you know, like you're just slugging it out on the couch, like things around you, like it's still happening, right? Your cells are rejuvenating. Like maybe you need that rest. Like it's giving your body a chance to heal. You're giving yourself a chance to recover from a hard day so that you're mentally ready to go the next day. Like every step along your journey is still transforming you, even if it feels like stagnation, unless you truly stop.
Right. So if the transformation part of doing is a lot mental, and that's why I referenced the self-perception episode, then what you're saying is you need to put your mindset in a better place. And first and foremost, you can understand that everything is transforming around you. It's always changing. Our skin's changing, our body's changing, the physiology, it's always changing. And so it's not like if you choose to make a transformation that you're doing something so outrageous, right? Because these things are always occurring. And that transformation process is just almost like a 0 and 1 codes. It's a yes and no answer, and it's yes, no, yes, no, yes, no, yes, no, and you're going down the line in this decision making tree to kind of improve your life. And that's, you know, surgery works that way, diets work with that way, nutrition and everything else we deal with, health. So I agree with you 100%. The second part of it is once you get into the transformation is, you know, keeping going with that transformation is actually following through. And that's where I think that people really lose it. They start out, they have gusto, they're kind of going through it, they're walking, and then they just kind of lose their wind in the end.
You hit the wall, and they're harkening back to surgery. This is about, 5 days after a tummy tuck, let's say. Someone's been feeling pretty good. They've been getting up walking. They've had a lot of support. Their husband or wife has been there with them. They've been making them walk every 20 minutes. They're keeping up on their meds.
Yeah, we see that all the time.
They're feeling like they've got this. And they call me.
And then the husband's like, okay, you're okay, right? I got to go back to work.
Got to go back to work, yeah. Here's the kids.
And then the patient's in a fetal position on the carpet, like, I can't do this. I'm in so much pain.
Right, feeling like, they can't do it. I get so many calls like that. Like, I just, is this normal? Like, It hurts. Like, I'm walking slow. I'm still not back to, 100%. Like, yes, we all hit those sticking points and in life and in general and in transformations, like specifically with weight loss too. That's a lot of what slows people down is like they can't perceive the changes that might be non-visible at that moment. Not every change is on the outside. Right.
Paul Ravella talked about that. He talked about with his clients that they're mad that they didn't lose 3 to 5 pounds a week, whereas he was pleased with a pound.
Or even a third of a pound.
A third of a pound, right.
Someone very lean and dieted down might be losing ounces.
That was a really good episode in regards to that. But to the point is that you're absolutely right. I think that one of the things about doing a transformation, if that's surgery or otherwise, is really try to plan it out. And think about it at all different angles. Prepare your loved ones around you. If it's surgery, obviously, for the surgery and the recovery. If it's dieting, if it's changing your exercise, getting people on board, getting people to help you out. These are things that make a difference. If you look at the scientific data on all this kind of stuff. So, for example, with weight loss, they've shown that anything that's in a group has better efficacy than anything that's solo. So we as humans operate better with social pressures and then social support.
Feedback.
Yeah. We're probably basically chimpanzees. You know, we have this chimpanzee brain that's a little smarter than chimpanzees in that we function at a higher level, but we go back to that group dynamic. And chimpanzees work that way. They work in a group. So, you know, I think that's a big part of it. Transformation in itself is an overly used word. You said that one time we were doing a podcast or episode that you talked about that it is overly used in our field. And it's done from a marketing standpoint.
It is.
Yeah.
Yeah, look at this transformation. Look at that transformation. Like it's like weight loss drugs. Like look at this transformation.
Yeah.
6 weeks.
But you were
Transformation.
referencing the visual stuff.
Yeah.
And I remember hearing that. I was like, well, she's kind of throwing plastic surgery under the bus because it is visual. But again, it goes back to the same thing. People do plastic surgery because they want to feel better, okay? Almost all the patients that come in here, they want to look better too, but that's not their primary goal. They just want to feel better about themselves.
Yeah, and feel better by looking better.
No, I know. I don't think, but it's more about how they feel. If you said to them that you could be in the 80th percentile of the best looking people or the 90th percentile, they'd probably pick the 90th percentile, but they're not coming in like saying, I want to be better looking than everyone else, right? It's about how they feel, their self-perception of what they see. And that's a lot different than something that's related to vanity and external. And that is why outcomes in plastic surgery tend to be pretty darn good. Because most people are motivated for reasons that are about themselves and how they feel as opposed to external things.
Correct. Yeah, you're willing to work a little harder for something that, like, that you're selfish isn't the right word, but that like you want for yourself.
Yeah.
Than you are for something you want for somebody else. In most circumstances, I mean, I love the types of studies that like they'll pair you up with someone you care about essentially and tell you that like you can both feel like 10 seconds of pain, or one person can choose to feel 20 and the other person doesn't have to feel any. And like how many people will be like, I'll take it. Like, give me the 20.
I would take it.
I would too.
Yeah.
I feel like, give me the 30. I'll take Nils's too.
Yeah, I know. I would take it.
This. I would.
But I wonder how many people would take it.
I think that's why those studies are so fascinating.
Right. And sure it's personality types too, you know?
Personality types, and what are you getting out of it? Like, to me, what would I get out of that? What would I get out of like feeling your pain literally? Like, I'd feel like I saved you from something. And
that's
that would,
what,
yeah. So ultimately that would make me feel good. So that's selfish.
Yeah, it is kind of selfish, I know. Yes. It's so confusing.
It really is. Let me ask you a question. Since you are a big part of our patient's transformation. Like, physically you are a part of this because you are doing this surgery. Like, do you ever take a step back? Do you ever have that moment where you feel like,
no,
I'm part of this, or I'm
no,
part of
I
something?
don't. And it's such a good question, and I think about it a lot now that I'm getting older and I'm successful and all this stuff. But it is funny because I think that you start thinking that way, then it becomes a little bit overwhelming first and foremost, and secondly, you kind of lose your edge a little bit.
Yeah.
You always have to push and be the best and push yourself. And if you start thinking like, oh, wow, look what I've transformed today. Look at all these transformations. It messes with your mind, and I think you get into an area that's bad. With that said, there are days, I'm like any other human being, that, I wake up and I'm like, ugh, and I will go to those feelings on those days. Mm-hmm. And that helps me put my feet on the ground and get going. And that's like few and far between, though. The other thing that does make me really happy, but it's not really a transformation, it's exactly the thing that you were referring to before, is looking at the photos, right? Because that takes the personal part. Because clearly, if someone comes in and they're all pumped up and happy, I'm super happy for them, right? Because I'm an altruist and I want to help them, and I'm excited for their transformation, right? But I'm not thinking like, wow, this person looks so amazing or so much better than this person. It's not like a judgment call. It's just the fact that that person is happy. We made them happy.
Yes.
Right? It's a gestalt.
Yeah.
But the times when I see the transformation part visually is when I'm looking at those pre and post photos, and I do that, I do that myself, and I lay them side by side. There's times then when I'm like, wow, this is truly remarkable. And those are the little nuggets that keep me going, right? But are those about the patient, right? They're about that visual change, right? The patient themselves could have a little bit of change and be super happy, or a lot of change and just be okay.
Yeah.
And so that when you get into the personal part and the mind part, that's wherein it kind of deviates a little bit. So the artistic technical part of me loves the before and after pictures. The human part of me loves to work with these patients and see them change just from a happiness standpoint.
Yeah.
And that's what keeps me going. The happiness keeps me going. And then the OCD driven part loves the photos. We have seen so many times with our patients, and we've said this many times before, they're like, I love the results, but I'm not really seeing it. Or like, it seems like, I mean, I can definitely tell a change.
But could we have done more?
Could we have done more?
That's
And
my
then you
favorite.
show them the pre-picture and they like cry, or they're like completely flabbergasted. And I have to admit, sometimes I'm the same way.
Oh yeah, sometimes I forget too, and I'm
I
looking
forget.
back. Even on the camera, I'll be like looking through, like, whoa, like you do, because the reason for that is, like I said, we're all transforming all the time. We get used to seeing an ever-changing version of ourselves. If we didn't adjust that way, we would all wake up one day and look in the mirror and be like, whoa, like waking up to a stranger, because over years,
But
a
don't you
lot
think people do
changes.
that? I mean, how many people come in and they'll say to you, they'll say to us, they'll come in for a face and neck lift and they'll say, I just woke up and I didn't recognize that person in the mirror. Well, that was a slow process, but
It was, and I think
you
some
think
of
it
those
was like
people,
kind of like a tipping point, maybe? Or
I think it's that, and I think people get very disconnected from it. We obviously look at things differently, and I honestly, like, I don't spend a lot of time looking in the mirror, but a lot of people do, and a lot of people don't. But I'm
So you don't look in the mirror because you're so good looking? Is that why?
no, I don't look in the mirror because I'm just avoiding mirrors. Like until recently, I didn't have a full length mirror in my house.
Throwing shade, eh?
Yeah.
Throwing shade.
I don't even need to look.
Yeah.
Well, not much is going to change. Someone told me recently that I look the same all the time. And they were not saying that as a negative, but like watching, like on our podcast where we reviewed all the podcasts from 2018.
Yeah,
and
everyone.
seeing the clips. I look the same to me.
If you're just listening to this podcast at first and you want to know what our podcast is all about, go back and listen to the last episode.
It's a good overview.
For the overview or the review of 2018. It was awesome.
You also get a little nuggets about who we are. But more to that point, like I think you do forget because you accept what you're seeing every day as it is. You're not like in your head like, okay, now how did I look 4 days ago? I mean, some people are competitors, right? Getting ready for a competition. They're taking pictures of themselves
That's few
every
and far
day.
between, though.
Few and far between. Your average person, your average tummy tuck patient, probably wasn't spending a lot of time staring at their abdomen in the mirror prior to surgery. They would look down on it and say mean things to it and like hate it, but they weren't really analyzing it after surgery. Then all of a sudden they start looking, right?
So that's a part of transformation that people don't understand. Transformation is kind of addictive, right?
Mm-hmm.
So we see that in surgery, that you get a change and you're like, holy cow.
The stars in the sky.
Yeah, right. And you've talked about that. And then they're like looking at everything and like what's next. And, you have to talk them back from the cliff's edge sometimes. Like, maybe let's just relax a little bit and heal from this surgery.
Yeah, let's give this 3 months.
Yeah.
Yeah.
It does, and that's a positive and negative because it does show you the potential that's out there to transform. Mm-hmm. And that's what, in some ways, makes us different than chimpanzees, right? Is that we can have this abstract thought, that we can think about transformations, we can actually do it and do this amazing change and then appreciate it from an enjoyment standpoint, a happiness standpoint afterwards. With that said, it makes you want to do more. Transformations take a lot of energy. In plastic surgery, it takes money too, in recovery and time out. Transformations are not easy. They're disruptive in your life, So even though we're always transforming, to really do what we refer to as transformations in our life, it's really make a right turn or do something that's different. It's hard. It takes a lot of energy, and it's hard to replicate. And that end part of the transformation could be sad for people too.
Right, especially because they've been getting a lot of positive feedback, even if it is just from like you and I, but they're going to be getting it at some point probably from another person. And that also is a good feeling. Like, yeah, I did this and like people appreciate it. And then, then as we all are narcissistic beings, we all just start focusing on ourselves again and,
And then life goes on.
It goes on. The train keeps going.
That's why with plastic surgery or anything else that you do a transformation, you want to have some structure in your life that allows that to keep going. If you do a tummy tuck or liposuction, then focus on your nutrition and do some exercise afterwards. Change your routine that you keep that going, right? If you do a diet and you lose weight, change your nutrition around for something you can do long term to maintain that weight loss, that kind of stuff.
Yeah.
If you
Or
work
have
with Amy for nutrition, keep adding on to the things that she teaches you and keep improving your diet. That's what, for me personally in 2019, that's what I want to focus on. Because I've lost weight, I've improved my life, but I'm going to do things like yoga, right? Or what's the word when you relax and clear your mind that I can never
Meditation.
remember? Meditation. I struggle
That thing
with that
where
word.
you sit and don't think of anything.
You're right. Well, what episode was
Think
that?
of all your clouds.
What
like
episode
thoughts.
was that? We talked about
I
that.
can't remember. We talked about meditation.
Yeah, I couldn't think of the word meditation. That's when you know you're really screwed from a meditation standpoint, if you can't even think of the word. Do things more with stretching, flexibility, meditation. So what about you? What about you for 2019?
Oh, such a big question. But for me, I think it's just being more aware of, kind of where I am in life and in the world, which I know sounds really big, but, just being more in the moment with people, and not getting so caught up in the grand picture, but really because those little things, those little moments, like you never get those things back, and just really kind of appreciating, enjoying like every little thing that happens and just kind of, collecting it all and just like pulling it all in.
I think it's really good. I struggle with that personally. I'm so goal oriented and so driven that you lose the small details.
Mm-hmm.
And, everything to me is analogous to surgery, but that's because I do surgery. But the
Every
small
tool is a hammer.
Right. The small details make a surgery,
Mm-hmm.
right? The little way you turn that suture to just a certain way that makes placement of that suture perfect and makes the results better. And that's the same thing in life. Those little details do make a difference.
They absolutely do. Yeah. And I think that's just kind of true to get like broader with society, but so much of what disconnects people now, technology, and I think people are just losing those little moments, that little bits of connection. Yesterday, the most amazing thing happened. Most amazing is maybe a stretch, but Chandra's our front desk, and I had gone across the street to get a refill on our Starbucks, and the guy there actually works at a different store that we go to a lot. And I've never remembered any interaction with this person. It's not like somebody that I'm like, oh yeah, I know that person, that barista or that, register person. Like, no, I honestly would not have even recognized that I knew him. He knew my name and he knew her name and he knew what we drank. I'm like, oh my gosh, like what's your, like, so I had to ask him, like, what's your name? Like, young kid, looked like he was maybe in his early 20s. And like, that to me is what is missing from so much of everyday life. And like we do the same thing when you ask me about a patient, and I will start rattling off like all these benign details of their life when what you really wanted to know is if they were having a facelift or a tummy tuck. And I'm like, their dog did this and they just had to take their kid to college.
The sad thing is I pretty much like know exactly who you're talking about when you mention those things.
Well, it's because I paint the picture.
I know. Every time our patients become family members pretty much.
Yeah, but it's picking up on those things and like really just enjoying all those little things and even some of the bad things and like the time sitting on the couch watching Netflix and, all the weird geeky things I do and just my stack of books at the gym, like just embracing all those things that are part of my daily transformation.
Right. I think that, so for 2019, I know that Amy and I are going to embrace transformation and we're going to keep moving forward. And hopefully everyone else does that's listening to this podcast. We're going to really focus on that transformation component in 2019. The biggest part of a transformation is educating yourself and preparing, which we focus on education in this podcast, and then empowering yourself to move forward and actually to do it. And then we focus on that too. So we're going to really build, in 2019, build these episodes around this idea. Also, it's going to involve plastic surgery, which is what I do for a living. And we're going to go more in depth. Actually, we're going to do some of the topics we've done before, but do them more in depth and more complete, or updated, probably is a better way to put it. Yeah. And definitely have some guests around this transformation topic. So it is funny because sometimes you're talking to these people and they're like, oh, you're a plastic surgery podcast. I'm like, it's not really a plastic surgery podcast. And then when they come on and they talk with us, they get it, right? You can see it click. You can almost hear it in their voice when they're talking to us, or if they're in studio, you kind of get, okay, now they get it. Like, oh, now I understand. Because people have such a weird view of plastic surgery, and then they hear me talk or you talk, and they're like, we're not much different,
Yeah.
That we're trying to help people improve their lives, period.
Yeah. And we're doing it through a unique way, just as they might be. And to anyone listening, one of the main things that keeps us going is being inspired on a daily basis. And, we would love to hear what you want to hear about. Like, ask us questions. Like, one of my favorite episodes in 2018 was a question from a viewer. She actually emailed me directly, and it was great. It was fun, and it's really, that to me is inspiring. Like, I want to hear what you want to hear about. Like, I want to help you. I want to educate you. I want you to feel empowered in your decisions and your transformation and like in life. Like, yeah, like bring it on. Like, we want to hear what you want to hear.
And we'll mix in some funny stuff and make it entertaining. So Amy has convinced me that I have to drink cod liver oil, which is I'm going to be doing daily every day for 2019.
Super healthy.
Yeah.
Yes.
Just can't figure out where to buy it, but apparently it's in the health food store.
Health food store. It's in the refrigerated section by the refrigerated probiotics.
All right, so that's good. Transformation. That's where our mindset is. That's where we're going to carry this with us moving forward, and hopefully you will too. Please rank us and rate us. We have a YouTube channel, Jason Martin MD, which has all these videos on there. And also we have, what's our Instagram for?
Instagram is at Beauty and the Surgeon Podcast. At Beauty and the Surgeon Podcast.
If you're watching the video, we're showing our swag right here, which is our coffee cups. And if you notice in the video, I drink all the time, which is one of my transformation points.
Green tea.
Green tea, drink some green tea.
Super high in antioxidants.
Huge. And it's been shown to lower breast cancer rates slightly. And it's very healthy and also hydrating.
It's all those things.
We got more of those transformation points coming up.
We do.
All right.
We want everyone to transform. We want everyone to transform.
All right. So thank you for listening, and we look forward to 2019. Let's do it, Amy.
Thanks, guys.